Massive eyelids. Please help. What can I do? I hate my eyes. Massive, hollow eyelids, crease too high, looks heavy and skeletal. Horrific. I wanted fillers to make it more puffy, but a surgeon told me it's dangerous to inject near the eyes. I thought about ptosis, but ptosis surgery is uncertain with asymmetries. Plus, it isn't so much the position of my upper lid which bothers me, as the size and hollowness of it. Please, there has to be something I can do, because at only 23, I honestly don't know if I could keep on with these old eyes.
Thank you for your question. You're 23 years old, and you describe in no uncertain terms that you hate what you describe as the massive, hollow upper eyelids, and that you've done some investigation and a doctor told you that it's dangerous to do injectables around the eyes. So, but you want to do something about your appearance. Well, I can give you some information to help guide you. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon. Dealing with hollow eyes is certainly a significant part of my practice, and I can tell you something about what we do in our practice to help patients. And of course, I may share with you a little bit more about what I would do for someone of your age who would come to me with the same kind of concern. To begin with, understand that the appearance of your eyes is mostly a genetic result, which means there's a combination of factors of bone structure and the way your eyes are shaped that create this very large zone where your eyelid creases are very high. Now, interestingly, a lot of people want that look and will undergo cosmetic surgery to achieve that look. And with that being understood, I can tell you that we have patients who are younger, maybe a little bit older than you are, but who come to us and have volume placement for cosmetic reasons. And we also commonly help people who have had surgery where they felt that too much fat was removed or they felt their eyes were hollowed, and we use fillers such as a hyaluronic acid filler to restore this volume. Now, I've done procedures such as fat grafting and ways to restore volume, and basically all of this is contingent on having something to push against, and that means the bone structure of the orbit, the eye socket. Essentially, you can't change to the true anatomy of why you have the shape that you have, but an illusion can be created by adding volume in what we call the sub-brow area. And by adding volume in that sub-brow area, you're able to restore this in a way that can look more full. We've done this for people who are Asians who had Asian eyelid surgery, and they looked relatively hollow, or as people have gotten older, they've looked like they're hollowing. Now there's opportunity there. I'm hesitant to recommend anything to you because I think that at 23, you can, as distressed as you are with your appearance, I think you'll have more distress with the challenges of achieving the optimal final result. Fillers still have a certain amount of unpredictability, even though it's a small amount, but in areas such as this, it may be difficult to get just the result you want. It may be a challenge to get the right volume. It means that you will have to come in several times in order to achieve a certain desired endpoint. And then at a certain point, that material goes away. So I think that although this is a procedure that is common for patients of ours who are in their 40s and older, it's fairly uncommon in people who are in your age range. Plus, something to understand is your skin is right now at a very tight, youthful zone. And it's very difficult to actually add volume when the skin is relatively tight. Now again, a physical exam would be helpful, but I would also agree with my colleague who is saying that it's dangerous to do things around the eye. The answer is yes, it is dangerous to do things around the eye, and there is always a balanced risk. As an oculofacial plastic surgeon, and I trained first in eye surgery, it's not that I'm in any way hesitant to work around the eye, but there has to be a balance of a justification to perform a procedure to try to help someone like yourself. I think you may find yourself dealing more with bruising, swelling, and other problems that I don't think justifies the effort. I think that if you want to learn more and maybe seek additional opinions, you should. But I would say wait before you do anything else. There may be other concepts and ideas in the future that are still not fully developed that we're not using as of yet. And until then, I think you should try to learn to live with what you have, understanding that also in your 20s, all of us who are long past that recall how good we looked at that time but didn't appreciate it. And so that's just a little side comment for you. I think that you may not be appreciating the benefit, and you may be a little bit overcritical of your appearance. I would suggest that you have this discussion with the people who are closest with you before you move forward with doing a procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.